Good afternoon. My name is Amit Kumar Chauhan. I am an aged care nurse who extensively work with older people who require comfort care. Palliative care is the area of uncertainty I am focusing on. The research article I have chosen is presented by Greer et al. The title of the article is Role of Patient Coping Strategies in Understanding the Effects of Early Palliative Care on Quality of Life and Mood. The early integration of oncology and palliative care improves the quality of life and mood for patients with advanced cancer. Uh, this term, early integration of oncology and palliative care, has been abbreviated as EIPC, and quality of life is abbreviated as QOL, where palliative care is abbreviated as PC. However, the mechanism by which EIPC aids these results stay uncertain. Therefore, the researcher tested whether EIPC enhanced patients' coping strategies and if changes in coping accounted for intervention effects on quality of life and depressive symptoms. I utilize CAPS tool to critically analyze this article. The researchers studied data from 350 patients with newly diagnosed incurable lung or GI cancer. For the secondary analysis of EIPC trial, participants completed different assessments. For quality of life, they did functional assessment of cancer therapy. For depressive symptoms, they completed patient's health questionnaire, and for coping, they completed brief cope assessment. These assessments were completed at baseline and at 24 weeks. The researchers utilized linear regression to test intervention effects on use of coping strategies and mediation regression models. Um, During this study, using the electronic health record, study staff identified potentially eligible patients from the outpatient thoracic and GI oncology clinics and notified oncologist. Then the oncologist invited these patients to participate in the study. They've been asked for informed consent. After providing informed consent, enrolled participants were randomly assigned to receive EIPC or usual oncology care alone. Patients assigned to EIPC met with board certified palliative care physician or advanced practitioners within 4 weeks of enrollment and at least monthly until their death, with the option for additional visits. Study visits focused on building rapport, managing symptoms, enhancing coping, improving understanding of illness and prognosis, assisting with treatment decisions, advanced care planning, and preparing for the end of life. Patients assigned to usual oncology care met with a palliative care clinician only at the request of oncologist, patients, or family. Regardless of group assignment, all participants received standard oncology care. With this particular study, blinding was not utilized just because it was not possible due to the nature of the intervention. The intervention group knew that they are receiving EIPC to improve their quality of life. Same reason applies to treatment usual group as well. The researchers could have blinded themselves, however, they couldn't because of resource limitations. When we talk about strength and weakness of the article, I would like to focus on weakness first and then I'll go to strength because uh, I found the article has more strength than weakness. So the weakness I see in the article is the choice of participants. A majority of participants were white male. For example, there were 92.3% people participants were white and 54% out of them were male. Their mean age was 64.84 years. So it really does not indicate the effects of EIPC in other ethnicity, gender, or age group. On the other hand, the positive aspect of the article are they are confirmation through evidence. For example, a prior cross-sectional study of patients with incurable cancer showed that coping with use of acceptance is associated with better quality of life and mood, whereas denial or self-blame are associated with worse quality of life and mood. This study confirms and expands upon these findings by demonstrating that changes in approach oriented coping strategies over time have similar effects. Moreover, the increased use of approach oriented coping strategy significantly accounted for positive effects of EIPC intervention on patients' reported quality of life and depressive symptoms. As healthcare system strives to increase access to palliative care services, clarifying the ways by which EIPC improves patient outcome can greatly inform um, care delivery. Given the sufficient number of palliative care clinician, given the insufficient number of palliative care clinician to meet the complex supportive care needs of all patients with advanced cancer, this data may guide the development of innovative model for delivering EIPC by highlighting which aspects of treatment require specialty palliative care expertise versus component that could be delivered through primary or mental health clinician. If I talk about my clinical environment, that is aged care, the article suggests that patients with incurable cancer who received EIPC showed increased use of approach oriented coping, which was associated with high quality of life and reduced depressive symptoms. Palliative care may improve these outcomes by providing patients with the skills to cope effectively with life threatening illness. End stage life care doesn't only impact on the patient but to the care provider like nurses like us and patient's family as well. So, uh, if we apply this theory, can be applied in my own clinical environment where we can deliver better palliative care and improve quality of life not only for our residents but their families as well. In summary, as a clinical leader at my workplace, I will introduce EIPC in next continuous improvement meeting, and I will also initiate the EIPC at my workplace and encourage everyone to participate by explaining the better outcomes in quality of life for the clients and their families. Now I'm going to provide the references. For some reason it's not showing the references. I'll try to edit the video to put the references because I'm unable to put for some reason, or I might put it in a separate link. Let's see how I go. Thank you.